Ostomy means opening. Otomy. 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 Tracheotomy. Otomy. Otomy is opening. Otomy is opening. Ostomy. Ostomy. Opening and attaching something. Opening and attaching something. Something is removing. Opening and removing. Opening and removing. Ostomy. Otomy. Got it? Got it? Okay, fine. So tracheostomy. What is it? Tracheostomy. What is the indication of tracheostomy? Indication. Indication. What is the indication of tracheostomy? Indication. Indication. Indication means? Indication means? Indication means? Indication means? In Telugu. Indication means? Sujana. Very good. Sujana. Sujana. Enduku cheyali. Enduku tracheostomy cheyali. Sujana. Indication. What are the indication? What are the indication? What is that? Respiratory tract obstruction. Ekkada? Upper. URT. Upper respiratory tract. Upper respiratory tract obstruction. Obstruction means? Obstruction means? Obstruction means? Block. Obstruction means? Black. Block. Obstruction means? Block. Obstruction. One indication. Next indication? Respiratory failure. Type 1 failure, type 2 failure. Respiratory failure. Respiratory failure. Next one is ET tube. ET, endotracheal tube. Endotracheal tube. Ventilation. Ventilation. ET, ventilation. Endotracheal tube. Intolerance. Endotracheal tube. Intolerance. Endotracheal tube. Intolerance. And one more point in bracket you write more than how many days? More than 5 days. More than 5 days of endotracheal intubation. More than 5 days of endotracheal intubation. That means simple concept, long term intubation, or endotracheal tube intolerance. Endotracheal tube intolerance. Next point, laryngeal cancer. Next point is laryngeal cancer, carcinoma, cancer of larynx, laryngeal cancer. CA larynx. CA means cancer. CA larynx. Next one is injury. Ekkada? Head, neck, chest. Ekkada? Head, neck, chest injury. Head, neck and chest injury. Head, neck and chest injury. At that time, it is indicated for tracheostomy. And another point, neurological disorder. Neurological disorder means coma, meningitis, VP shunting, encephalitis, spasm, isn't it? Palsy, every neurological disorder. Neurological disorder means again prolonged ventilation, long-term ventilation. Have you got the indicators? Have you got the indicators? Okay, fine. Next. Types or classification of tracheostomy. Classification or types. Tracheostomy classification. Tracheostomy classification. First, based on patient condition. Based on patient condition. What are the types? What are the types? Based on patient condition. What are the types? emergency and prophylactic. Emergency means immediate. Emergency means immediate. Emergency means immediate. Prophylactic means మనం తెలిసి ఏం తెలిసి patient needed prolonged ventilation. Patient needed prolonged ventilation. Head injury, brain injury, or patient is having any neurological deficit or chest injury At that point we assumes that this patient need prolonged ventilation. Then in order to give oxygen support, we will prefer tracheostomy rather than ventilation, ET tube. Rather than ET tube, we will do tracheostomy. Why? Because we know that this patient need prolonged ventilation. Prophylactic. What do you mean by prophylactic? Prophylactic antibiotic. Prophylactic antibiotic means we know this patient may get infection, but we don't know what is the exact causative organism. Arthayinda? Exact causative organism, virus, bacteria, enta bacteria, we don't know, but we know this patient may get infection. So prevent that infection prophylactically. We will start antibiotic. Same way here, we don't know how many days this patient need ventilator support, but we know long term. So prophylactically we'll go for tracheostomy rather than ET2. Got it? Emergency means immediate. Got it? And next one, according to time. Temporary means short term. Permanent for long term. According to time, temporary and permanent. Short term and long term. Got it? Next one, according to position. Ekkada pettali. Where we are inserting tube? In the trachea, first ring, second ring, third ring, fourth ring. 4 rings are there, and ideally we will prefer second and third. Ideally we will prefer second ring and third ring. So if it is first and second ring, that is called high ring. Upper, paina. Ekkada? Paina. Kinta. Low ring means third and fourth. Ideal site is second and third. Second means high, third means low. First and second high, third and fourth low. Ring. Got it? 4 rings. First ring, second ring, third ring, fourth ring. First and second ring high, paina. Third and fourth kinda. Got it? Low ring. So ideal site. We'll discuss in the next slide. So what are the type classification, tracheostomy classification based on the patient need. What are the types? Emergency, prophylactic. Emergency means immediately. Prophylactic means selective. We know this patient need long term. It is selective or planned. Prophylactic means selective or planned. Emergency means immediate. And next one is according to time. Temporary means short term. And permanent means long term. Got it? According to time. Next classification according to position. Ekkada pettali position. High ring, low ring. High ring ante first or second ring. Low ring ante. Got it? Got it? Okay, fine. Next one. Types of tube. Types of tracheostomy tube. Types of tracheostomy tube. Okay, fine. First we discussed types of tracheostomy. Now we are discussing about the type of tube, tracheostomy tube. So here you can see tracheostomy tube. What are the parts of tracheostomy tube? Parts. What are the parts? Here you can see outer cannula, inner cannula, obturator or pilot. See, here you can see outer cannula. What you can see? Outer cannula. There is an outer cannula. And there is a inner cannula. And there is one rigid obturator. What is that? Obturator or pilot. Which means outer cannula. We are inserting the trachea and fixing it. What we are fixing? Outer cannula. Just right. Parts. First you write parts, then we will discuss types. Okay. Outer cannula. Okay. Ideal tube site. Okay. Ideal tube site we will discuss in the next slide with the location. Site with the location, with the bone, with the cartilage. We'll discuss again. No need to worry. Okay, no need to worry. Nani, wait. We will discuss. In the next slide, we will discuss. Okay, here, the types. Okay, the parts of tube. First one is outer cannula. Why we are using outer cannula? For fixing. First, we will insert outer cannula. That outer cannula, what is the function of outer cannula? Fixing in the skin, fixing in the trachea. Where we are fixing it? Trachea or outer skin. What we are fixing? Outer cannula. And then there is inner cannula. We are inserting inside the outer cannula. This is outer cannula. Inner cannula we are inserting the outer cannula. This is outer cannula. It is fixed. And now we are inserting inner cannula. Just write inner cannula. Outer cannula fixed. Where? In the skin. We fixed the outer cannula. What is we are fixing? Outer cannula. Where we are fixing? In the trachea we are fixing outer cannula. Next is inner cannula. Fixing inside the outer cannula. Inner cannula fixing inside the outer cannula. Outer cannula, inner cannula. Next one. Obturator. Okay. So what is the use of this inner cannula? We can take it out, place it. For what purpose? Cleaning and reuse. So inner cannula we will remove, clean, reuse. But outer cannula fixed. But inner cannula removing, cleaning, reinserting. But at that time of removing for cleaning, we have to place obturator. At that time, we have to keep obturator next. Pilot. Next, you write pilot or obturator. Pilot or obturator. What is that? It is a valve. It is a valve. What is that? Valve used for, it is a valve, obturator or pilot. It is a valve used for inflation. Inflate. Valve used for inflate and deflate. Inflate and deflate what? Outer cannula. Inflate and deflate outer cannula. For what purpose? To prevent block. To prevent block. Got it? To prevent block. These are the parts of tracheostomy tube. Then there are different tube. There are different tube. We will discuss one by one. First is double lumen and single lumen. First type we are discussing. Now we are discussing types. Single lumen, double lumen. First type is, okay, Nani, inflate means not fixing. For fixing, we insert outer cannula for fixing. But we are using inner cannula. This is outer cannula, it is fixed. And there is an inner cannula. Through this inner cannula, we will connect ventilator. Through this inner cannula, we will connect ventilator. Outer cannula still, it is fixed. Outer cannula fixed. Inner cannula is there and we are connecting ventilator to inner cannula. This inner cannula, daily, we can take it out, clean it, insert. So at that time, when we are taking it out, at that time, we will keep obturator, the pilot. For what purpose? This trachea should not collapse or block. Trachea should not collapse or block. For that, we need to inflate the outer cannula. That is why we are inserting obturator. If we remove obturator, this outer cannula deflates. Then if we insert, it inflates. I got it? That is dilation and constriction. Dilation, constriction. At the time of cleaning inner cannula. I got it? Got it? Okay, fine. You can see the diagram. You can see the diagram. See here. This is outer cannula. This is outer cannula and this is inner cannula and this is the obturator. Obturator. It is a hard thing. Hard one. Got it? Got it? Got it? Okay, fine. Now we will discuss about the types. Types. Which are the types? First one is double lumen and single lumen. Double lumen and single lumen. Double lumen means two lumens. One is outer lumen, one is inner lumen. Another type is single lumen. Only one lumen. Lumen means layer, sheath. Lumen means sheath, layer. How many layers? Outer layer, inner layer. One lumen, two lumen. See, suppose we have a pen. Pen outer covering, inside there is a refill. Two lumens. Only outer. That is single lumen. Have you got it? Got it? Same here. And next type is cuffed and non-cuffed. Cuffed and non-cuffed. Cuffed, non-cuffed. Cuff means cuff. One balloon for inflating balloon in ET tube. Have you seen ET tube? See, listen here. With this balloon, we are inflating this balloon, and there inside that cuff will be inflated. For what purpose? Fixing. For what purpose? Fixing. So cuffed one, non-cuffed one. What are the types? Cuffed and non-cuffed. Cuffed we are using for adult, non-cuffed we are using for children. That is the important point. Cuffed for adults, non-cuffed for children's. Cuffed for adults, non-cuffed for. Got it? Okay. Next type. Fenestrated and non-fenestrated. Fenestrated and non-fenestrated. Fenestrated and non-fenestrated. Fenestrated and non-fenestrated. So fenestrated. Do you know what is fenestration? Fenestrated. Type of capillary. Do you know type of capillary in our body? Artery, vein, capillary. So capillary. Do you know types of capillary? What are the types? 3 types. Which are they? Artery, vein, capillary. Capillary, again 3 types. Which are they? Continuous, fenestrated, sinusoid. Have you heard about it? Heard about it? Sinusoid, continuous, sinusoid, fenestrated. These are the 3 types. Okay, leave it. Fenestrated means holes. Fenestrated means holes. See, listen here. Normal tracheostomy tube. Normal tracheostomy tube. One opening here, another opening here. One opening here, another opening here. But fenestrated means here they are having holes. Here they are having holes. That kind of tubes are called fenestrated tracheostomy tubes. Fenestrated tracheostomy tube. Why we are using this? See, in ventilator, ET tube, ventilator, we use a terminology weaning. Do you know that weaning? Breastfeeding, weaning. What is that breastfeeding and weaning? Weaning means not stopping. But what? Gradually. Koncham. What we are doing? We are changing the diet. Isn't it? In the sense, first complete breastfeeding. Then breastfeeding plus supplementary feeding. Then supplementary feeding increases, breastfeeding decreases. Then slowly breastfeeding stops, only supplementary feeding. Got it? Weaning. Slowly we stop breastfeeding. Same way, ventilator full support, then we will change to SIMV mode, half support, then very low support, then no support, CPAP, then stop, extubation. Same way here in tracheostomy tube, the weaning. First full support, then we will remove the full support. We will do half support. That means patient has to do breathing by himself. For weaning, we are using fenestrated tracheostomy tube. So fenestrated, bracket you write, weaning purpose. Fenestrated means, in bracket you write, weaning purpose. Okay. So you know flute. What do you call in Telugu? Pullang. Flute only. Pulla? Yes, that's it, flute. Multiple holes. If you blow, sound ostade. Isn't it? Sound. So same way, this fenestrated tracheostomy tube is called talking tracheostomy tube. Talking tracheostomy tube. Why? Because whenever patient try to breathe, these through holes, air moves and there will be sound. Got it? So that is called fenestrated tube is called talking. Got it? Okay, fine. Next. Yes. Okay. So fenestrated, weaning purpose, and it is called talking tracheostomy tube. Talking tracheostomy tube. Got it? అయిపోయిందా పిక్చరా జూమా అయిపోయిందా Next. Okay, so type of tubes. Which are the type of tube? Double lumen, single lumen. Then cuffed, non-cuffed. Then penetrated, non-penetrated. So what are the types? Double lumen, single lumen, cuffed, non-cuffed, penetrated, non-penetrated. Have you got it? And parts? Parts, outer cannula, inner cannula, obturator, cuff, balloon. Got it? Got it? Okay. Move to next. Move to next. Fine. Now we are discussing with the procedure. Discussing with the procedure. Here we will discuss about the location, position, site. Okay. Now we will discuss. Got it? So, what is the size? What is the site? Okay, before site, position. What is the position? What is the position? What is the position? What is the position? Rose position. Rose position. Rose position. Or we can say supine with hyperextended neck. Supine with hyperextended. So what is extension? What is hyperextension? What is flexion? Identi flexion. Identi extension. Very good. Identi hyperextension. Arthayinda? Hyperextension. This is extension. This is flexion. So for tracheostomy, in the position hyperextension. Arthayinda? Supine with hyperextension. This very clearly we have to see this position. Where is the position? Where is the site? Where is the site? Site. Incision site. Incision site ideally. Incision site ideally. Incision site ideally. Second and third ring. Ekada. Which cartilage? Which cartilage? Tracheal ఎంత cartilage ఉంటాయి? Tracheal, how many cartilages are there? 20 rings are there. 20 rings. First ring, second ring, third ring, fourth ring. And in that, ideally we will use second and third ring. Okay. Which cartilage? Trachea. Okay, fine. Trachea is the entire windpipe. That windpipe is covered by tracheal cartilages. Which cartilage is ideally used for tracheostomy? Yes, come on. Tracheal. Yeah, 16 to 20 rings are there. Very good. 20 rings we can fix to is 20 rings. It is 16 to 20 rings. Okay, fine. But yeah, come on. Thoracic vertebral level, or we can say that T2, T3, T4 level. Which cartilage? Starting with T, not cricoid, Amala, not cricoid. T, starting with T. Thyroid. What cartilage? Which cartilage? Thyroid. Which cartilage? Thyroid cartilage. Which cartilage? Thyroid cartilage. What is the shape of thyroid cartilage? Butterfly, yeah? What is my question? Thyroid cartilage. I never asked for thyroid gland. Butterfly shape is thyroid gland. What is it? Gland. Gland is different. Cartilage is different. What is it? Question is for cartilage, not for gland. Gland, grandhi. Got it? Cartilage. Cartilage is different. Gland is different. Okay, got it? Never write butterfly for cartilage, thyroid cartilage. Okay? That is what, again I am repeating. Understand the question. What is that? Understand the question first. Then only answer. Got it? Understand the question first. Then only answer. Got it? Okay, fine. So, what is the shape of thyroid cartilage? C shape is the C shape. C shape you are saying about the rings. You are saying about the rings. Why it is C means anteriorly it is cartilage, posteriorly it is fiber. What is that? Anteriorly cartilage, posteriorly fiber. That is what it is look like C. Otherwise it is a complete ring. Complete ring. But anteriorly munteninchi cartilage, cartilage. Posterior fiber. That is what C. That is not the shape of the cartilage, thyroid cartilage. Oh, butterfly. Don't say butterfly. Champitanu. Champtaru. Fine. Okay. Thyroid cartilage is different. Thyroid gland is different. Thyroid gland is butterfly. Okay. Thyroid gland. But thyroid cartilage. Thyroid cartilage. Huh? Very good. Thank you. I will say. What is the shape? Shield shape. What is the shape? Shield shape. What is the shape? Not triangle, Nanny. Very good try. Not triangle. It is a shield. It looks like triangle, but it is not triangle. It is shield. 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 Shield ante? Kattappa. Kattappa. Shield. Shield. That is round. That is round shield. But this is like this. Like this. Not a triangle. Not a triangle. Triangle means like this. Is it same? No. Okay. But it is almost similar, but it is not same. Shield. Shield. Okay. Got it? Shield. No need to worry. No need to worry. No need to worry. In medical surgical, we'll show you the pictures. In medical, okay. Cricoid, signet shape, ring shape, every shape we will show. Okay. Okay, fine. Yeah. So here, what is it? What is the site? Second or third ring or thyroid cartilage or T2, T3, T4 site. T2, T3, T4 site. And what is we are using? Thyroid cartilage. Okay, thyroid cartilage. Almost isthmus area of thyroid gland. What is isthmus area? Isthmus. Have you heard about it? Okay. Right lobe, left lobe. This portion is called isthmus. And this connecting area is called isthmus. This connecting area, this is thyroid gland. Butterfly. Butterfly. Look like butterfly, right? Look like butterfly, right? Okay. Right lobe, left lobe, intermediate lobe. The entire thing is connected in isthmus. This portion is called isthmus. Okay. In anatomy physiology, we'll discuss in detail. So this portion is used. Got it? Got it? That is a site. Got it? And next, position over, incision over, and this is after tracheostomy position. We'll discuss. Next one. What is the procedure? We provided position. First, position. Next, we identified the Location. We identified the location. Malli em cheyali. Next em cheyali. Next em cheyali. Tracheostomy procedure. Next em cheyali. First position. Next location identified. Malli em cheyali. Cleaning. Suctioning em cheyali. What you are suctioning? Oral suctioning ah. Malli side chair open avaledu. Malli enduku suctioning? Cleaning cheyala odda? Cheyali. Fine. Next one, cleaning. Isn't it? Next step. First position. Second one is site selection. Third one, cleaning. Very good. Cleaning. Aseptic technique. Isn't it? Aseptic technique. Cleaning. Third step, cleaning. Fourth step, cleaning chesna. Okay. Ippudu cleaning అయిపోయింది. Next. Hole. We have to make a hole. Incision. Very good. Next, incision. Make an incision. Where? At the located site. Incision. Ippudu em cheyali? Incision అయిపోయింది. ఇప్పుడు ఏం చేయాలి? Suction cheyali. Very good. ఇప్పుడు ఏం చేయాలి? Suction. Incision అయిపోయింది కదా? Next ఏం చేయాలి? Suction. Okay. Suctioning. Maximum time for suctioning? 5 to 10 seconds. 5 to 10 seconds. Maximum time? 5 to 10 seconds. 5 to 10 seconds. 5 to 10 seconds. Okay. I will give you 3 questions. After this, I'll give you 3 questions. Okay, fine. Then, after suction చేసిన తర్వాత ఏం ఇన్సర్ట్ చేయాలి? Outer canal tube. Tracheostomy tube. Insert cheyala odda? Yes, we can insert. Tracheostomy tube. Insertion of tube. Next step, insertion of tube. Tracheostomy tube. First position chesna, then location identify chesna, malli cleaning chesna, tarvata hole, make a hole, then insertion. Then what we have to do next? Apde inserted. After that, leave it. No? Fixation. Featuring, isn't it? Stitching and fixing. And then connection of ventilator. And then whenever it is indicating, we can do suction, clearing, suction. Maximum time for suction? 5 to 10 seconds. Minimum 5 seconds. Maximum 10 seconds. More than 10 seconds? Less than 10 seconds? Less than 10 seconds? Okay. More than 10 seconds? Oh, no. Got it? And after that, what we will do? ఇప్పుడు ఫిక్స్ చేసిన మళ్ళీ ఏం చేయాలి? ప్లేస్మెంట్ ప్రాపర్ గా ఉందా లేదా చెక్ చేయాలి. Isn't it? We have to check the position, proper positioning, proper placement. What are the methods of proper placement? First, we will check with, what is that? Auscultating the sound. Bilateral air entry unda leda. Same time, chest expansion, recoiling unda leda. 2 methods అయిపోయింది. ఇంకొకటి, that is the ideal method. What is that? Very good. Photography. What is that? Chest X-ray. What is that? Chest X-ray. First, lung sound, auscultation. Next, chest expansion, recoiling, chest movement. And third is the important one, ideal method. What is that? Chest X-ray. Got it? Chest X-ray. Then after placement, after confirmation of the placement, ఏం చేయాలి? Position. What is the post-tracheostomy position? Fowler position. What is the pre-op position? Rose position or supine, hyper extended. Have you got it? Okay, Murali, we can use soda bicarbonate, or otherwise we can use antihistamine. Sorry, catecholamines. We can use catecholamines. Okay, for suppression of secretions. Okay, that also we can use soda bicarb. Okay, fine. And yeah, very good. Atropines, isn't it? We can use to suppress the secretions, isn't it? To suppress the secretions. Fine, fine, fine. Very good, very good. Okay. Yeah, fine. Okay, got it? Got it? Next. Before going to this suction pressure, three questions. Right? Three questions. First one. Ideal position for tracheostomy. Ideal position for tracheostomy. Before writing this question, write question. Ideal position for tracheostomy. Options. Ideal position for tracheostomy. Options. Okay. First option, supine with hyperextended neck. Supine with hyperextended neck. Second option, Ross position. Third option, Fowler's position. Fourth option, A and B. Both A and B. So what is the answer? What is the answer? What is the answer? Got it? Okay, Rajashekhar, go through all the options. First option, supine with hyperextended. Second option, Ross position. Third option, Fowler's. And fourth option is both A and B. Got it? So what is the right option? D. Option D. Option D is the right option. What is that? Both A and B. Got it? Okay. Never rush into answers. Read all the options. Got it? Read all the options, then answer. Okay, next question. Ideal time for suctioning. Ideal time for suctioning to a tracheostomy patient. Ideal time for suctioning to a tracheostomy patient. Okay, options. Just be careful with the options. Option A, 10 seconds. Option A, 10 seconds. Option B, less than 10 seconds. Option B, less than 10 seconds. Option C, more than 10 seconds. Option D, 5 seconds. Be careful with the options. Answer very carefully.
Less than 10 seconds.
First option, 10 seconds. Second option, less than 10 seconds. Third option, more than 10 seconds. Fourth option, 5 seconds. What is the ideal answer?
Less than 10 seconds.
Got it? So here the option. Really confusing, isn't it?
Yes, sir.
10 seconds. We taught that 10 seconds. 5 seconds. Yes, we taught that 5 seconds is there. 5 to 10 seconds we taught. More than 10 seconds. We don't do that. But less than 10 seconds. Suppose these are the options. Always go for Less than 10 seconds. So what is the answer?
Less than 10 seconds.
Have you got it?
Yes, sir.
Have you got it? Okay, not 10 seconds, not 5 seconds, but less than.
10 seconds.
Okay, fine. Next we will go for to pressure. Suction pressure. Suction pressure. Suction pressure means suction pressure. Suction pressure means how we are doing suctioning. How we are doing suctioning. How we are doing suctioning with the suction catheter. Centralized suction or portable suction. Centralized suction or portable suction is there, and how much pressure we need to set there. How much pressure we need to set there. That is this pressure. Got it? One more question I'll give one more question, I know. Okay, fine. Coming to here. Preterm. Preterm baby. What is the pressure? 40 to 60. 40 to 60. Got it? And next, infant. What is the pressure? 60 to 80. And for children, what is the pressure? 80 to 100. And for adult. And for adult, what is the pressure? 100 to 120. 100 to 120. 100 to 120. Here most important question is two area from adult and adult and preterm baby. Why preterm baby? Why preterm baby? Preterm baby means lung is not matured. Why? Surfactant is not well produced. What is there in surfactant? Two proteins, phospholipids and lipoproteins. Which are they? Lecithin and sphingomyelin. 1:2 ratio. But in preterm, 2:1. That means immature lung. So if we put more pressure, what happens? Rupture, collapse. Rupture and collapse. So that is important. So preterm and adult. Preterm, what is the pressure?
40.
And adult? 100 to 110. I got it? Okay, fine. Next one. Catheter size. Suction catheter size. Suction catheter size. Suction catheter size. Suction catheter size. What is the suction catheter size for 5 to infant? 5 to 8 fringe. 5 fringe, 6 fringe, 7 fringe, 8 fringe. Is it smaller or bigger? Smaller. Okay. Yeah, very good. Okay, fine. Next, child 8 to 10 and adult 12 to 18 and ideal is 14. Ideal is 14 and we can give 12, 14, 16, 18. But ideal is 14. Got it? Okay, fine. Next one. Have you wrote it? Next one. One more thing is there. Just write tracheostomy tube size. Tracheostomy tube size. Tracheostomy tube size. Tracheostomy tube size. Okay. So you just do one thing. Write a column. Just draw a table with 2 column and multiple row, 2 column, 2 side. One side age, next side size. Very good. Next side size. Here age of the children or adult or anyone, and here size of tracheostomy cannula. First one you write. First one, newborn. 2.5 to 4 mm. 2.5 to 4 mm. 2.5 to 4 mm. 2.5 to 4 mm. Okay. Yes. Most used and commonly used 14 size. 14 size. Okay. Next one, infant. Infant is 4 to 4.5 mm. Infant is 4 to 4.5 mm. Next is children. That means less than 10 year. Children less than 10 year. Children less than 10 year. What is the size? 5 to 7 mm. 5 to 7 mm. 5 to 7 mm. 5 to 7 mm. Next one is more than 10 years. Children more than 10 year. Children more than 10 year. More than 10 year. What is the size? 7 to 8 millimeter. 7 to 8 millimeter. 7 to 8 millimeter. For adult. Next one is adult. Adult is 8 to 9.5 mm, but men is different, woman is different. We will discuss. Adult average size is 8 to 9.5 mm. 8 to 9.5 mm. But for men 7 to 9 mm. Average is 8. Average is 8 mm. So for adult male, what is the ideal size we are using? Average size 8 mm. Average size is 8 mm. Next one is woman. Woman is 6.5 come 0.5 low. 6.5 to 8.5. 6 woman, ladies. Okay. Gents and ladies. Okay, fine. Woman 6.5 to 8.5. Average and the less 1.1 less. 7 mm. 7 mm. 7 mm. These are the sizes of tracheostomy tube for ages. Different ages. Got it? Got it? Have you got it? Okay, fine. Have you wrote it? Okay. Okay. Fine. Next is time. Time for what? Time for what? Time for what? Suction. Yeah, even metal tube. Yeah, yes. Metal tube is available. Metal tube is available for suctioning. Very good. Venkatramana. Yes, very good. Suction. Time for suctioning. Time for suctioning. Okay, what are the time for suctioning? No, Nani, no. Metals are used for longer time. Metals for permanent and longer time. This plastic and plastic types are there. That is used for short time. Metals for longer time. Okay. Okay, fine. So next is suction time. Suction time on the day of tracheostomy. On the day of tracheostomy. That means first 24 hours. First 24 hours. ఎప్పుడు సబ్స్టెన్స్ చేయాలి? Every 30 minutes. Every 30 minutes. Every 30 minutes on the day, first day of tracheostomy. Tracheostomy day. What is it? What is it? First 24 hour every 30 minutes. And next one is after then every second hourly. Second hourly. Next day onwards. Second hourly. And what is the time? What is the time? Here one concept is there. They wrote 10 to 15 seconds. 10 to 15 seconds. But it is not ideal. It is not ideal. Always remember less than 10 seconds. Less than 10 seconds. Most commonly, this tracheostomy patient will be in NBM. This patient will be in NBM, nil by mouth or nil per oral. So we will prefer parenteral nutrition. But even though we suggested every half an hour, every second hour we suggested, but still there is indication. There are indications. What are the indications? If there is any sound, secretion sound, isn't it? Or in the ventilator, peak pressure. Peak pressure means there is any obstruction, secretion, obstruction. All this situation we have to do suction. Got it? Other than this. Got it? I got it? Okay, let me check the next slide. What is that? Complication. Okay, fine. Okay, so we will wind up for today and we will continue the complications in the next class. Okay, complication in the next class. Okay, fine. Actually, Nani, that is a good idea. That is a good suggestion. Suppose if the patient is orally allowed. Orally means we will put NG tube. Some patients are entirely protein deficiency. At that time, parenteral nutrition plus oral nutritions are allowed. Not every patient, for some patients. At that time, protein supplements we will give. Protein powders, Ensure powder for protecting liver, HEPA pure, Ensure, all this powder. Sometimes they will suggest for every 2 hourly they will suggest feed. At that point, what we have to do? Before giving feeding and after giving feeding. After giving feeding, we have to do suction plus positioning. What is the position? Semi-foulers to foulers. 30 degree to 40 degree elevate cheyali. Lekapothe aspiration. Got it? Okay, fine. Okay, yeah, we'll wind up for today. Yeah, Nani, actually what is happening after giving food? What is the suggestion? Suggestion means it is not oral suctioning. If there is anything stucking, we need to check whether any food particles are there. Any food particles or any fluid is there in the airway. That is what we are doing, suctioning. But it is a 5 to 10 second, maximum 5 to 10 second. There is no much pressure. Why we are doing that thing is, we know if we do suction, there will be irritation of airway and they may have a gag reflex. But what we do, always we do paralysis of the tracheal area. There won't be any gag reflex. Okay, at that time what we have to do? We have to ensure it. We have to ensure it whether there is something in the airway. That is what we are doing. Okay, otherwise it is not necessary. But in the practical side, we used to do. Okay, Nani. Okay, fine. Okay, fine. Yeah, Nani, that we will discuss. Feeding is different topic. We will discuss. This is just about tracheostomy. Okay. Okay, fine. Yeah, Sandhya Rani. It's me, Praveen. Okay.